click on here. And just to let you know, this is the Confused About Medicare workshop, because what you don't know will hurt you, not for just a little bit, but for the rest of your Medicare life. You want to make sure that you do not make a mistake, and we are going to teach you how to personalize your Medicare. Again, if you need to do any questions, we already got questions coming in. Well, questions are already coming. And that's great. So again, if you've got questions, you can email them to info@tonisays.com, or afterwards you can give us a call. And I just want to let you know a little bit on how I got started. I've been doing this for 10 plus years, and I went from a book to a mission. So what happened was I ended up having someone call me. They came to a workshop and they said that they didn't have Part B of Medicare because they had called Social Security. Well, they called Social Security and got the wrong information. I knew what the answer was. And I took the Medicare and You handbook. This is your Medicare and You handbook. And I put it in people terms. And this is the book, Medicare Survival Guide. So anyone that gets confused, you want to have some answers, you're reading articles that are coming out of the newspaper. And this is the local newspaper here in Houston. We're in the Houston Chronicle, and I am in different papers nationwide. So the articles are in the Medicare Survival Guide Advanced Edition. And everything that I'm going to tell you is in the book under an article, or we've got a PowerPoint. You've got information that you can look at. Okay. Like I said, if you've got questions, then let us know. And slowly but surely, we're starting to grow. There's more people coming on. And as I said, everything is for educational purposes only. If you need a personal consultation, we can do this nationwide, because Medicare is the same in Houston, Texas, where I'm at, as it is in New York, as it is in California, Florida, Ohio, wherever you're at. It doesn't matter what part of the country. Medicare is a federal program. Okay, so we can help you with your situation, getting everything started for you, getting you on Medicare, help answer questions about your parents, whatever your situation is. So I'm just making sure everybody can hear me. It sounds okay. Just if you'd raise your hand, that would be very nice. Looks like everybody can hear. Okay. And slowly but surely. Okay, so let's get started. Right now, I am now part of a new organization called seniorresource.com. And that is a website, and it is a very special website, because not only does it talk to you about Medicare, but it has everything. If you have a diabetic issue, if you're looking for an assisted living center, whatever your situation could be, Senior Resource has different areas that you can work with. So their website is Senior Resource. There's 2 R's, SENIORESOURCE.com. And it's an amazing website. It's growing. And I have my podcasts. The podcasts are found at seniorresource.com. You can also go on the Toni Says website, and there's an icon, and you can click on it and see the podcast. So we're slowly but surely getting more podcasts each week. If you have a certain subject you would like us to talk about, we can do that. And pretty soon I should have a YouTube channel where we can help you answer your questions and get everything specific for you. You want to personalize your Medicare. So let's get started. We do have an office. Our office is in Sugar Land, Texas. If you don't know where Sugar Land is, it's right close to Houston. But we can also do Zoom meetings, or we do Zoom or Google Meet, and we can do it anywhere nationwide. It's the same in Texas as it is anywhere else, okay? Only thing that's different is what prescription drug plan, what Medicare Advantage plan, or what Medicare supplement there is. So let's get started. We're going to talk about Medicare Part A, B, C, and D. And this is what your Medicare card looks like. A lot of people don't have the same dates down here. Their Part A started at a certain date when maybe they turned 65, and their Part B started later because they left their work. Not everybody has everything starting when they're turning 65. So what you got is people are new to Medicare and they're confused. What you need to realize is that Social Security is the person that processes all the paperwork for Medicare. Medicare does not know how to enroll you. Is that not sad? They're the ones that process the claims and everything, but they do not enroll you. Social Security does all the enrolling. Okay? And I will talk about this in just a few minutes. If you're new to Medicare, if you're someone who's turning 65, and maybe you're like me, you're self-employed and you want to get on Medicare because you can't wait to get on decent insurance because you've always had an individual health plan, then this is a website you're going to want to use, because you have to go online and enroll in Medicare online. Medicare, their number is 1-800-633-4227. Medicare helps you with your prescription drug plan. They can help you enroll in a Medicare Advantage plan, or they can help you with your claims, but they do not, and I repeat, do not enroll you in Medicare. Social Security does all the enrolling. Medicare has 3 family members. You've got the IRS that knows everything about us, knows how much we made, whatever. You have Social Security, which processes and enrolls people in Medicare. And you have Medicare, who processes the claims. If you get confused, just send us an email. And the email is info@tonisays.com. And our office number is 832-519-8664. The 8664 stands for Toni. And we're slowly but surely getting more questions. And I've got one question here about VA. And then I have another question about different high deductible plans as far as Medicare is concerned. Okay, so we'll discuss that. So let me talk about how to enroll in Medicare. Here is the easiest way to enroll. Someone who is turning 65 and receiving their Social Security check, poof, you're going to automatically get your Welcome to Medicare kit somewhere around 90 days prior to you turning 65. And you'll be enrolled in Medicare, okay? Someone who's turning 65 and not receiving your Social Security check, then you are going to want to go to socialsecurity.gov/benefits/Medicare and enroll in Medicare. You need to open yourself up a SSA.gov account, a My Social Security account, because you have to be already enrolled in Medicare, in Social Security, to enroll in Medicare. You have to have one of those accounts to do it. If for some reason you can't enroll because maybe you've had your credit compromised, you've had your Social Security number compromised, your credit account is locked because you've had fraud or whatever, then you need to go back to the Social Security office and let them help you enroll. If you are turning 65 and not receiving your Social Security check and not working for a company full time. I'm self-employed. I've always had an individual health plan. So I got on Medicare 2 years ago. And I had to go online and I got an individual Medicare account set up. And I ended up getting on a Medicare supplement with a prescription drug plan. I couldn't wait to get on Medicare because I've always had a high deductible plan that I never met the deductible. And let me tell you something, it has been a blessing in disguise. So again, if you got questions, email us, email the questions, and we'll be glad to get those answers. I do have one question, and it says, this one is from Dale. And he says, I have coverage under the VA. So Dale probably got his Social Security check and he's got the VA. And he says, do I need or should I get Medicare as well? Well, that's a different situation. When you're someone that's on VA, you can decide whether you want to enroll in Medicare or you don't. You want to get Part A, and Part B. As soon as you sign up for your Social Security check, you're going to automatically get Part A, but you want to decide, should you get Part B? Well, when you're a veteran and you're going down to the VA and you're talking with everybody, someone will say, well, I didn't sign up. I'm using the VA. So if you never signed up for Part B of Medicare, then you have to stay at the VA. Because if you come out, you're going to have to pay money out of your pocket. So I would advise Dale to go ahead and sign up for Medicare Part A and Part B, because you never know when you need to go somewhere else. Okay. A person who's turning 65 and not receiving their Social Security check, you're going to want to go online and enroll in Medicare Part A and Part B. And we can look at the different plans that you can enroll in just a few minutes. Someone who is turning 65 and they're past 65 and still working for a company, what I would do is talk to my HR, talk to Human Resources, and see if you need to enroll in Part B of Medicare. Because if you've got company insurance and you're still working, you can delay your Part B for a later date. And we're going to talk about that. I'm sure there's a few of y'all that's something that interests you, because you may be working until you're 70. Some people work till they're 75. We have people that are 80 and 90 years old coming in the office that are now coming off their company insurance. So if you're past 65 and 90 days and you're still working, then what you need to do, this is the form you're going to want to sign up for. It's called Request for Employment Information. And this is form CMS L564. I write about this in my Medicare articles, but I also have a few articles that are in the Medicare Survival Guide about the CMS L564 and the forms that you need to file if you're leaving your company insurance. That's very, very, very important. And if you're still working for a company, you're past 65 and 90 days, and I will go over the timeline in just a few minutes, and you're leaving your company benefits, then you're going to want to fill out the CMS L564 and have your employer sign it. If you leave that company and go to work for another company, you've got to turn every company form in of the Request for Employment Information, the CMS, everybody write this down, it's CMS L564. You're going to want to have every company that you're working for past 65 to fill out a form. I had a lady that had 4 companies that she worked for, retired when she was 69. And one of the companies, she did not have them sign a form. And she messed up, got on COBRA, waited too long, and ended up getting a Part B penalty. So this form is very important. All right. And here's your initial enrollment period. This is for people who are turning 65. You can enroll in Medicare 3 months before the month that you turn 65. Okay, my birthday was in May, so I could enroll 3 months forward. This person, they're turning 65 in July. They can enroll April, May, June. So just count back 3 months and you can enroll in Medicare. Your Medicare will start the first day of the month that you're turning 65. And then you can enroll 3 months after. Anything after 90 days after the month you're turning 65, if you miss that enrollment, you get a penalty. And the penalty is 10% for every year that you should have had Part B but failed to enroll because you were not working full-time with True Company Insurance. Again, all the information is in the Medicare Survival Guide about that. We've got the different articles. And if you are working for a company and you are coming off that company insurance, then we advise you to get the CMS L564 filled out. Make sure you've got Medicare Part A with your Medicare number. And the other form that's going to be used is the CMS 40B, which is your application for Part B. And you take it down to your local Social Security office and they will enroll you in Medicare. That's the only time you go to the Social Security office is whenever you're past 65 and 90 days and you need to enroll in Medicare because you're coming off your company insurance. That's very, very, very important. If anybody, like I said, needs a consultation, then email us or call us and we'll be glad to help you. So if you got any questions, send them. We've got one question here, and this is very important. This is talking about whether a high deductible Medicare Plan G is good. And if you have an HSA through a company, what you should do. If you have an HSA, then call us, all right? Because people that have an HSA past 65, the minute you sign up for Part A of Medicare, the minute you get your Medicare number and you just have Part A, you cannot fund your HSA anymore. So this has to be very specific done. Medicare is confusing. It's like a maze. So let us know what you need, what question you want to have answered. So if this person has an HSA right now, they're fixing to turn 65, we would advise them don't sign up for anything with Medicare until you're fixing to come off your company insurance, until you're fixing to retire. The second that you sign up for your Social Security check, that's when your Part A would start. So everybody's situation is different. You're going to want to personalize your Medicare, make it for your own. All of the insurance companies that are doing all the marketing right now, they don't want you to personalize it. They want you to go for their plan because they want you to think it's the best, but you want to make sure that what you're doing is the best for you. There's two letters Medicare does not like. It's letter B and letter F. One is best and the other one is free. That's what the letters stand for. What's best for me is not best for you. And what's best for your friends may not be best for you. And Medicare is not free because you have worked to pay into get Medicare. There's two parts. We got Medicare Part A, we got Medicare Part B. Right now, all of your tax dollars that's going is because you worked 10 years or 40 quarters to get Part A at no cost. Part A is not free. You've had to pay to get it. And right now, under Part A, you've got a $1,600 deductible, not once a year, but it's 6 times. So every 60 days, this thing recycles, and the deductible for an inpatient hospital stay is $1,600 6 times a year. When Medicare got started, when LBJ signed Medicare into law, when President Johnson signed Medicare into law, the whole cost for Medicare was $40 for a whole year. That's all they had to pay. But $40 in 1965 was a lot of money. And the premium for Medicare was $3. Things have changed. We'll go through the premium in just a minute. So your hospital, inpatient hospital stay covers going in the hospital, having a hospital stay. It covers skilled nursing, hospice, and home health. All of this is covered under Part A of Medicare. Okay? It does not cover long-term care, and it does not cover outpatient services. All of that is covered under Part B. Part B is your lifeline. That's everything. B is like gold. So the monthly premium for this year, and we'll go into income-based, Medicare is income-based. For this year, the Part B premium is $164.90. So you pay $164.90 and you get Part B. There's a $226 deductible for 2023. I'm giving you the numbers for next year. Medicare pays 80% and you pay 20% with no stop loss. So if you have to go get chemotherapy or radiation or cataract surgery, or your doctor is going to do back surgery, it starts as an outpatient, you're going to pay 20% of whatever that is. There's ways to pick this up, and we'll talk about that in just a minute. Okay? Again, if anybody's got any questions, we've got info@tonisays.com. And here's the phone number if you want to set up a consultation. So Part B is for medically necessary services. If Medicare doesn't think they're medically necessary, then your Medicare plan, your Medicare is not going to pay. But guess what? Your Medicare Advantage plan is not going to pay either. It has to be medically necessary. Okay? It pays for your doctors, your MRIs, your heart scans. It pays for everything under Part B. That's where everything gets started. Outpatient care, preventative services. But as I said, Medicare is income-based. So for next year, they've changed the numbers and it went to the better for us. For an individual, anything that is $97,000 or below, or as a couple, it's $194,000 or below, then your Part B is going to be $164.90. Anything else, if you're making money because you're still working, you will have to pay more. And I'll show you at the end of this workshop how to pull these numbers down. You can make changes because you may not be working anymore and you might retire. Medicare goes by what you made 2 years ago to charge you for Part B. So whatever your income was 2 years ago is what you're going to have to pay. And Social Security is the one that processes this paperwork. Like I said, there's 3 family members. You have the IRS, Social Security, and Medicare. And they all work together. So the IRS tells Social Security what your income was. If your income is not that amount anymore because you retired in the last 2 years, then I'll show you at the end of this workshop how to pull these numbers down. But they have gone up. If you're still working and you're on Medicare and you end up getting a Medicare supplement or a Medicare Advantage plan, but you're still working, then you may have to pay more because you haven't retired. That's my situation. I have not retired, but I'm still working. So I have to pay more for my Medicare, which is fine with me because I used to have terrible insurance. All right. So we're going to discuss what you need to do to have everything picked up, have nothing come out of pocket. And this is a Medicare supplement, works with original Medicare. A Medicare supplement is not the same as a Medicare Advantage plan. So the supplement is going to work with original Medicare and it helps to fill the gaps. Okay. And you have the freedom to come and go. So to get a Medicare supplement, you must have Part A and Part B. Okay, so hopefully you guys can hear me. I got 5 people that have raised their hand. Donna, can you hear me? Is it fine? Okay. So here's a question. I got a question from Carrie, and it says, I turned 65 in July and I was working and had insurance. I have not done anything with Medicare. Okay, here's Carrie's issue. I just got laid off on October 14th. You just spoke a little bit about this. What should I do? So Carrie, and I'm going to go back to the calendar. Okay, let's go back to this calendar right here. Hold on. This is Medicare's initial enrollment period. So Carrie turned 65 in July. She was working, but she got laid off in October. We're now into November. Okay. I don't know who Carrie worked for, but what she needs to do is sign up for Part A of Medicare, go online and sign up for Part A of Medicare so she gets her a Medicare number. If she needs help, she can email us and we can help her with that. Sign up for Part A. But she needs to take the form, the CMS L564. She can go online and download it off of the Social Security website, or she can email us and we can email her one of the forms. She needs to take it back to her employer and have them sign it, showing that she's been working, because she is past her initial enrollment period. It's probably a good thing that Carrie, I don't know what part of the country Carrie's from. She may be here in Texas, but she's right here. And she missed her enrollment date because she turned 65 here. Are you guys getting this? So I'm seeing some hands raised. I know I'm not asking for questions because it gets too confusing, but that's what Carrie needs to do. That's very important. She's the reason why I do what I do. Okay. Here's another question. This is from Catherine. She says, my brother is in Florida. He's 71 and has Part A. He has VA and is in an assisted living center. He never got Part B or D. Was told by Social Security that he can't sign up for Part B or D until January of 2023. And it won't take effect until July. Okay. He never signed up. So what Catherine needs to do is give us a call, because this is specific on what he needs. Okay. If he has to sign up for Part B, then he does need to sign up between January through March, and his Part B will start in July, but he's going to have a penalty that goes all the way back to the day that he turned 65. So I would advise Catherine to give us a call. Okay. This is very important that it gets done the right way, because he has the VA. They're going to have to ambulance him back to the VA for medical. She can talk to the assisted living center and see how about getting a doctor. I mean, there's a lot you got to look at, guys. This is called planning. Okay. So I'm sorry I keep going back, but I like to answer the questions. So we got Part A, Part B, and like I said, here's your Medicare supplement. It helps to fill the gap. There's nothing like a Medicare supplement. You have every hospital and doctor nationwide that's accepting Medicare. Okay. And sometimes people just, you just have to take it as it's coming. And with the Medicare supplement, you've got the freedom to come and go. You must have Part A and Part B. When you're first getting on a Medicare supplement, you have a guaranteed issue. You can get a Medicare supplement for the first 6 months without having to answer one health question. Okay. Let's see. So hold on just a minute. I just had something pop up. A Medicare supplement does not have Part D. Okay. I would sit down with Catherine, with her brother. He can get his prescriptions from the VA. Okay. Obviously, the assisted living center is out for money. There are certain things that he needs to do in Florida. Okay. So he may not need to enroll in a prescription drug plan. We would have to see what his situation is. He can get his prescriptions from the VA. So that's got to be pretty specific. With a Medicare supplement, you've got a 6-month window that you can get any Medicare supplement you want without having to answer one health question when you first get Part B for the first time. That's why it's so important to personalize this and make it just for you. Okay. So with the Medicare supplement, Plan G right now is the top of the line plan. And what you have as your deductible, which is for Part B for next year, is $226. That's all the out-of-pocket you have. And it depends on what zip code you're in, what state you're in. These are state-specific plans. With the Medicare supplement, if your Part A started after January 1st, 2020, you can only get Plan G. If you've already had Part A longer, you can get Plan F. So we would have to look at what your situation is. Okay. Again, if you guys got any questions, we got info@tonisays.com, and there's the number. So a Medicare supplement works with original Medicare. It does not work with an Advantage plan. It does not work with company insurance. It just works with Medicare. That's what a Medicare supplement is. A Medicare Advantage plan, most of them are HMOs or PPOs. They have 2 other different plans, which is a private fee for service and special needs. There aren't very many of these, but there are some. But most of them are HMOs and PPOs. That's what you're seeing advertised right now. And with the Medicare Advantage plan, you have to go by their rules. You have to have Part A and Part B to have everything picked up. If you only have Part A, then the Medicare Advantage plan is not going to enroll you. You have to have both, Part A and Part B. You've got to obey the plan's rules. You got to go by their rules. You must stay in network. You have to use their doctors. If you go out of network, then you may pay more money. If you go with an HMO, you have to stay in network. You have to use their doctors. And you do not use your Medicare card, your red, white, and blue card. You use the plan's cards, and you've got to obey their rules. Okay? And that's where it gets confusing, because a lot of people want to come and go and pick and choose where they want to go. And they're looking at the premium, because some of them are $0 premium, $10. And that's what's in the Medicare and You handbook. At the very back of it, it shows the different Medicare Advantage plans and the different prescription drug plans. This book has to go out in the mail and be to you before October 1st, so you can start planning for yourself. There are no current numbers in this book. So if you're trying to compare it to what next year is going to be, the numbers aren't there. They were not done prior to the Medicare and You handbook being issued. But all of the Medicare Advantage plans are here. And you can get specific with your Medicare Advantage plans or your Medicare prescription drug plans by going to medicare.gov. I advise anybody who has a Medicare number, whether it's Part A and Part B, to go online and sign up and get a medicare.gov account. They're very important, because you can find your right prescription drug plan. You can find the Medicare Advantage plan that may work in your network that you may want to use. It's very, very, very important. So with the Advantage plans, you do not lose your Medicare, you just don't use it. Medicare pays the insurance company X amount of dollars a month. And it depends on how many stars you get as to how much money the companies are making. They do not release how much they're paying each insurance company. So the more stars, the more they make, and they get paid each month. So that's why they're looking for all the people to enroll in an Advantage plan so that they make more money. And they have to pay all their care out of this. A Medicare Advantage plan is not the same as a Medicare supplement. You cannot compare them. They're totally different. So if you want to know the specifics on it, we'd have to do it on a one-on-one basis. So as I said, you don't lose your Medicare, you just don't use it, okay? You put your Medicare card away and you use your insurance company's card. So what you have, the next part is Part D. That's the prescription drugs. And how that works is there's two ways that you can receive your prescription drug plan. You can get it standalone with a Medicare supplement or with original Medicare. You get a standalone Part D plan, or you can do it with a Medicare Advantage plan that has Part D with it. Okay? And it has deductibles and copays, and most important, it's got the famous donut hole. So if anybody's concerned about the donut hole, let us know. I just had a few more questions come through. And you need to enroll at the right time. So anybody that's coming off your company insurance, you're past 65 and 90 days, and you're coming off your company insurance, you're going to have 63 days when you leave your company insurance to get a prescription drug plan, or you're going to get a penalty. Okay. So we make sure when someone comes in or we do a consultation for somebody that you get your prescription drug plan, and it's not that hard to do, to figure out what's most important. So here's how a prescription drug plan works. For this year, the deductible for 2023, the deductible is going to be $505 on the Medicare Part D plan. And I need to let you know that the donut hole has not gone away. They've changed names on it, but it's still there. So once the true cost of your drugs grows to $4,660 for 2023, you get in the donut hole and you have to spend $7,400. The donut hole will go away in about 5 years. But for right now, I deal only specifically with what's going on today. And you can see, like Humira is $5,000 a month. Anybody that's taken Humira or Enbrel, you automatically get in the donut hole the second you go and pick that prescription drug up. And when you get in the donut hole, here's what happens. You pay higher amounts. And these amounts are not changing. They change in a couple of years, depending on what prescription drug plans they let cover to keep from getting the donut hole. If you're confused, I know that you're going to be confused because it's hard to understand Medicare and the prescription drug plan until you experience it. So once someone gets in the donut hole, here's what happens. Here's the pre-donut hole. You're going to have a copay. When you get in the donut hole, you're going to pay 25% of that brand name drug. And the drug company is going to pick up some, and the Part D plan is going to pick up some. We'll go over that in just a minute. But when you get into catastrophic coverage, you only pay 5% of that drug. So as you can see with Humira, instead of having to pay the $5,200, you're going to pay 5%, which is $260. Okay, so people know when they have an expensive prescription what they have to pay. So when you get in the donut hole, you pay 25% of that brand name drug. The drug company pays 70%. So if that's Pfizer or Lilly or whoever it is, they pay 70%. but the Part D plan will pick up 5% of your brand name drug, of whatever the drug is, until you reach $7,400. And then you end up paying the catastrophic coverage, which is generally about 5% of that drug. Okay. So when someone gets in the donut hole, they know it, definitely. And if you need to do prescription drug planning right now, we advise everybody to go online and get a Medicare.gov account. It puts your prescriptions in there. If you've already got a prescription drug plan, it'll show what plan you have. It'll show what your costs are going to be, and you can see it, and you can find out which prescription drug plan you can get for next year, which is good. Okay. But this, when you get in the donut hole, you feel it. Okay. And as I said before, you have to pay a premium. So anybody whose income is $97,000 or below as an individual, or $194,000 or below as a couple, then your Part B for next year is going to be $164.90. If your income is higher when you're retiring, you're going to pay more. But not only do you have to pay it on your Part B premium, you have to pay it on your Part D premium also. So anybody whose income is under $97,000 or under $194,000, then your plan premium, you won't have to pay extra. But you can see right here, if your income is this much, they go by what you made 2 years ago, then you're going to pay extra on your prescription drugs, but you also pay extra on your Part B also. And you're going, well, wait a minute, Toni, this doesn't make any sense. I'm already retired. I retired last year. I'm not making the kind of money that I made when I was working a year and a half ago. Or when I retire, I'm only going to be making my Social Security check. I may be 68 years old and I'm now retiring, but I'm going to be making my Social Security check. I don't care if you've got $1 million in your 401k. If you're not earning that kind of money, when we do a consultation at the office, we help you to let Social Security know what your income is going to be. And what happens is there's a form that you can file, which is called the SSA 44 form. And that number is in the back. That form is in the back of my Medicare Survival Guide. The cost and the numbers are in the back of here of the book, and the forms that are found on the Social Security website. So if you're not making the kind of money that you were making when you retired, you can appeal your Medicare Part B and Medicare Part D decision because you're not earning that kind of money. If you're still working, you can't appeal it. That's me. I'm still working. I can't appeal it until I retire, which may be a couple of years from now, because I'm 67 years old. I am on Social Security, but I'm not planning on stopping working because I enjoy what I do. You can file the SSA 44 form, which is a life-changing event form, and it can help bring your income down. It can help bring that Part B and Part D premium down. We brought it down for a gentleman who was making over $900,000 with Wells Fargo. He retired at 65, was on his Social Security check, and brought his Part B premium down from $527 down to the $164 only by filing this form. So what you got to decide is, do I want to wait 2 years for the IRS to notify Social Security that your income has come down, or do you want to tell them? I would think you'd want to tell them. So I would tell them by filing this form, and they will backdate it back to the day that you turned 65. You don't want to wait too long. If you wait a year and then you want to file the form, they're not going to give you your money back. But if you only wait a couple of months and you go back and file the form, they will backdate it back to the day that your Part B started. I had a gentleman who turned in his 401k, got the cash on it, and there was about over $1 million in it. And he got the Part B IRMA penalty, and he ended up appealing it, but it took him almost 2 years to appeal it. They gave him the money back for the second year, all the way back to January 1st, but they did not give him the previous year. So he lost 12 months. He couldn't get the money back. So they brought it all the way down to the $164.90. He got paid back. So don't wait. That's what we do when we do a consultation. We let you know what the situation is. So I got a couple of questions here. So here we go. So here's another person asked this. I turned 65 in July, and they're asking, what is the donut hole? So here's where the donut hole is. I've already pretty much explained what the donut hole is. Once the true cost of your drugs grows to $4,660, then you get in the donut hole, and you have to spend $7,400 out of pocket when you get in it, and you're going to end up paying 25% of that cost. The drug company, like I said, picks up 70%, and your Part D plan, all these little guys are in bed together. They all have to pay parts of it, and they have raised the cost of the prescription drugs because they're not going to lose money having to pay 70% or having to pick up the 5%. Okay. And let's see what other questions I have. Here's a question from Kevin. I have a March 2023 birthday. If I enroll in December of 2022 with Social Security, will I still need personal health insurance until my actual birthday of, it's going to be March 1st is when his Medicare is going to start. Will I need to get personal health insurance? If you're coming off your company insurance, you may want to get COBRA for a couple of months until March 1st. And then Kevin can get either a Medicare supplement or a Medicare Advantage plan, depending on which one he wants. And it all depends on what you want to do. I don't know what his insurance is that he has right now. He may have none, or he may be on company insurance. Everybody's situation is different. So I would advise him, yes, you still need something, because what happens if in January or February you have a car wreck and you have an issue? What are you going to do? Okay. And here's some more questions. Hold on just a minute. This is coming from Conroe. This is from Mary in Conroe. My husband and I are turning 65 in February. We want original Medicare with the Medicare supplement. We are looking at using Christian Medishare as our supplement, and I'm not really sure how that works. Is this something you would recommend? Christian Medishare is not a Medicare supplement. Totally different. So you need to look into that. That's a very important, watch the marketing, watch what's happening. So a Medicare supplement, they have their number, they have their letters, Plan G, Plan F, Plan M, Plan N, Plan K, whatever. G is the top of the line right now for a Medicare supplement. So you want to be careful with what you got. Okay, here's someone who is going to turn 65 and the husband is still working and they are on the husband's insurance. Do I need to sign up for Medicare? What should I do? You need to sit down with the husband's HR and find out. Maybe you have a high deductible plan with the husband. Maybe it's costing a lot for you to be on his insurance. I don't know. You want to customize and personalize this. So it all depends. I can't answer that question. So when someone's asking, do we offer assistance with Social Security? We help you go to the Social Security office and sign up for Medicare. We can advise you on your Social Security. I mean, it's very simple to just go online and sign up for Social Security. That's not hard to do. Here's one that says, I will be 73 in June. I have Medicare Part A, and the company I was working for has laid me off. Okay. As part of a severance, they agreed to pay for my medical insurance. What should I do? Well, because that person is 73 years old and they have Part A, I would advise them to go ahead and sign up for Part B of Medicare. And let's look at what the company Cobra is like, or let's look at a Medicare supplement and see what your situation is. You could use the Cobra as your prescription drug plan and still get a Medicare supplement. If your family, his wife and his son are on the Cobra plan, then you can opt out of Cobra. That's one of the rules as far as Cobra is concerned. Get a Medicare supplement or a Medicare Advantage plan for yourself and let your wife and son be on the Cobra plan. It all depends. What do you got here, Donna? Okay, here's someone that's talking about TRS, Teacher Retirement System, and they want to know about TRS. What should they do? We'd have to take that on a case-by-case basis on what's going on. They want to talk about TRS and see what's going on. TRS, they're being bombarded with everything because they're turning 65 and really don't know what to do. So you want to look at it and see, maybe you have a lot of prescriptions and the TRS plan is good for you, or maybe you don't. Maybe it's going to cost you more to be on TRS because of their out of pocket versus being on a Medicare supplement. I don't know what her situation is until I see what we can do. So you can see how confusing this can be. So if you've got more questions, because I'm going to try and wrap this up right now. You know, I need to let you know anywhere from October 15th through December 7th, right now we're in Medicare Advantage annual enrollment period. That's where you can enroll in a Medicare Advantage plan, or you can enroll in a prescription drug plan. That's all it's about. It's not about buying dental. It's not about buying a Medicare supplement. You can change to a Medicare supplement, or you can change your Medicare supplement if you've got one any day of the week. If you're going from a Medicare Advantage plan to a Medicare supplement, make sure you get that supplement in place first. If you're going from a Medicare Advantage plan and you've got a Medicare supplement, please try your Medicare Advantage plan for a month or two to make sure you like it before you drop your Medicare supplement, because then you've got to answer health questions. It can be real confusing and real overwhelming. We just advise everybody to make sure you like what you change to. How does that help you? Okay. So if you need any help, we do a little bit of long-term care. We do help you understand what you're retiring to. Got any good questions? Okay, Donna just brought me this, and here's what this says. I have been a stay-at-home mom. I never reached 40 quarters to get my Part A without a premium. My husband has. So this is from Lisa. Lisa, here's what they're going to do. Whenever you turn 65 or your husband leaves his job and you need to sign up for Medicare, they're going to ask you to take your marriage license down to the Social Security office, an original copy, so that you can get on his Medicare. That's the good thing about being married. You can get on his Medicare and you'll have Part A. And when he leaves his work, you can get Part B of Medicare and not have any problems. So now the questions are starting to roll in because I'm fixing to stop this situation. So here's a question from Nancy. And she says, since I retired 12 of 21, can I file the SSA 44 form right after, I guess she's turning 65. Yeah. When you got the same birthday as my sister. So she's turning 65 in December and her income 2 years ago was higher. Can she file the SSA 44 form? What you're going to want to do, Nancy, is sign up for Medicare Part A and Part B. Okay. You can call us. We can help you sign up. And when you get your form saying what your Part B premium is going to be because of IRMA, that's when you're going to want to file the SSA 44 form. That's how that works. So again, if you got any questions, if we didn't answer anything, don't hesitate to email us. I don't want to drag this on. One thing I can say, there are dental plans. You want to make sure that your dentist accepts whatever plan you want to get. You don't want to just sign something up because you think you have a dental plan. You want to do your research, okay? Again, you can look on the seniorresource.com website, and there is a lot of information, not just on Medicare, but on retiring, on helping your parents, on finding an assisted living center. It's an excellent website. And I've got my podcast. Everybody says that they've learned from them, and they've been very, very, very helpful. So we've already asked for questions. If you end up needing a question, you can email us. And we just want to let you know, we do have a newsletter. It gives you the information that you need. And it can be found on the Toni Says website, as well as finding out how to get to the podcast is on the Toni Says website. And if you still have questions, just let us guide you through the maze of Medicare. Again, the number is 832-519-8664. And here's our website. Here's the email, info@tonisays.com. I just want to thank you for joining us. I want to thank you for being here. I just want to say God bless America and God bless you. We are in the best country there is. Thanks a lot. And I look forward to hearing from you guys.